M1046, influenza vaccine received. Did the patient receive the influenza vaccine for this year's flu season? The time period in which this measure is collected is at transfer to an inpatient facility or discharge from the agency OASIS. To accurately assess this indicator, consider patient-caregiver interview, consultation with the physician and other healthcare providers, and a review of the clinical record. Medicare's intent for this indicator is to identify if during this year's flu season did the patient receive a flu vaccine, and if they did not receive a flu vaccine, then to identify why it was not received. Response number 1 is selected if your agency provided the flu vaccine to the patient. Response number 2 is selected if your agency provided the flu vaccine to the patient prior to the start of the flu season. In other words, the flu vaccine was administered when the vaccine became available or during an earlier episode of care. Response 3 is indicated if the patient caregiver received the flu vaccine from another provider, which could include the physician, a clinic, or a health fair. Response 4 is applicable if the patient refused the vaccine. Select Response 5 if the influenza vaccine is contraindicated for medical reasons such as hypersensitivity to the component of the vaccine, a history of Guillain-Barré within 6 weeks after a previous vaccination, or bone marrow transplant within the last 6 months. Response 6 is selected if age condition guidelines indicate that the influenza vaccine is not indicated for this patient. Response 7 is selected if the vaccine is unavailable due to a CDC-declared shortage. Response 8 is selected if the patient did not receive the vaccine due to a reason other than responses 4 through 7. This indicator is one of the indicators selected in the value-based purchasing model and should show improvement by assisting the client to receive a flu shot administered during the flu season unless it is contraindicated. This indicator is only collected at transfer and discharge, so it is helpful to know the immunization status of your patient at start of care and work throughout the episode of care to ensure your patient is immunized. It has also been noted to improve care if the agency has a standing order for pneumonia and influenza signed by the medical director in the agency's policy and procedure manual. Establish a tracking system to know immunization status of patients. Possible tracking ideas include: ask your vendor to create a report to show immunization statuses from the comprehensive assessment fields for each immunization. Run your report weekly and share with managers weekly or monthly, and ask for another report to compare results with transfer discharge OASIS C items.